Hi everyone, I am Charmikala, head nutritionist and lifestyle expert with Team Look. I also head the pregnancy vertical with Look. And today I'm going to talk about nipple care during breastfeeding. Breastfeeding is one of the nature's wonder. You can feed your little miracle with your own body. With this, many mothers face challenges while breastfeeding the baby. The main complaints are red, sore, and inflamed nipples. But what causes this? There are more than one reason for nipple to get sore from breastfeeding. The first cause, incorrect latching, is a major cause for the cracked nipples. When your baby latches onto your breast to nurse, the mouth should be covered over your entire nipple and a part of alveolar. Second cause can be tongue tie or mouth condition. If you and your little one just can't seem to get hang of latching on correctly, it could be that your baby has a problem with their mouth. A condition like tongue tie, lip tie, or a high palate might make it hard for them to nurse properly. Third cause can be nipple confusion. Now, nipple confusion is just what it sounds like. Your baby gets a bit confused and disoriented about what type of nipple he or she is sucking on. If you're breastfeeding and also giving your baby bottle or a pacifier, your little one might have a hard time switching back and forth and figuring out the right way to latch on to your breast. And last but not the least, if the mother has got mastitis, which is an inflammation of the breast tissue or a yeast infection or a milk blisters. For all this, we need to look for the solution. Check how can we prevent it. Prevention is better than cure, as we all know. So try these tips to keep your nipples in the optimal condition. The first, a good latch is a key. So try to find out what works best for you and your baby. You can adjust the way you want to hold your baby. Try out some different positions which works best. A lactation consultant can guide you as well. Second, you can try icing your nipple before breastfeeding to ease the initial discomfort of your baby latching on. Try applying ice to your nipples before breastfeeding. The cold will help to numb the area and take the sting off just before you start nursing. Wrap an ice cube in a light cloth or towel and gently press onto your skin for a few minutes. You can do this before feeding as well as throughout the day. You can even try cold cabbage leaves compress, which is also a great option because they are actually known to help and reduce pain and inflammation. How can you do this? Freeze a few cabbage leaves and place them on the side of your nursing bra when you lie down. You can also try applying a warm compress after nursing. In contrast to applying a cold compress, before you breastfeed your baby, apply a warm compress afterwards. The warmth can give your sore nipples temporary relief. So for this, how you can do it? Simply soak a cloth in a warm water, remove the excess water, gently place the warm cloth over your nipples and let it sit for a few minutes. After removing the cloth, make sure you pat dry your nipples. Next thing which you can try is hand express your milk. If breastfeeding or pumping is just too painful and all else fails, try hand expressing your breast milk before nursing. If it's most important to release the breast milk one way or other. If you let the milk build up, your nipples won't be only the sore thing for your body, but milk buildup can be very painful for your breast and can even make more difficult for your baby to latch on correctly. So, releasing this buildup will reduce the risk of your breast becoming overfull and hard and developing a mastitis. Doing this also helps to maintain your milk supply, helps to reduce the soreness of the nipple, and can heal the cracked nipples over the time. Also, your bra plays an important role. So make sure it is very well fitted, supportive, and breathable bra. Or you can even try applying the fresh breast milk, which actually helps to heal the damaged nipples. So what you need to do, take few drops of fresh milk, fresh breast milk, and you can just apply on the nipple with very, very gentle massage. This may help to reduce the pain while nursing the baby. Happy breastfeeding!